We're going to change presenters to Ron Landry now from the Ministry of Labour, and he will introduce his colleagues as well. Thanks.
Okay, so my name is Ron Landry. I am the Provincial Coordinator for the Industrial Health and Safety Program of the Ministry of Labour Training and Skills Development. Further along in this presentation, I will be joined by Vince Latona, Occupational Health and Safety Manager, and Denise Madsen, Infection Control Consultant. So this resource does not replace the Occupational Health and Safety Act and its regulations and should not be used as or considered legal advice. Health and safety inspectors apply the law based on the facts in the workplace. This resource does not replace the Occupational Health and Safety Act. It is the responsibility of workplace parties to ensure compliance with legislation. This document does not constitute legal advice. So, Ministry of Labour Training and Skills Development, formerly known as Ministry of Labour, is our mandate is the Occupational Health and Safety set, communicate, and enforce the Occupational Health and Safety Act and its regulations. So the Occupational Health and Safety Act applies to farming operations that have workers as defined under the Act. This includes temporary foreign workers. Give me 1 second here. So the Ministry of Labour Training and Skills Development works with system partners to develop and implement health and safety awareness and training programs to reduce and prevent fatalities, illnesses, and injuries in the workplace. As you see on this page, there's a number of our partners that we work with on a regular basis, and they all have their individual websites with all sorts of resource information, contact information, guidance that you may find useful in your situation. So some of the objectives of going through this information is looking back at lessons learned from the last 3 months of our on-farm activity during the pandemic. We'll be highlighting the importance of reporting on the part of all workplace parties, including the Internal Responsibility System, or IRS as we tend to refer to it, and also to provide further education, support, and compliance assistance to employers and workers regarding reporting requirements and the Internal Responsibility System. So since the onset of the pandemic, we've been providing education, advice, support, and enforcement regarding the health and safety of agricultural workers in Ontario. The Ministry has been working closely with the Ministry of Health, Public Health Ontario, local public health units, health and safety partners and associations, farming stakeholders, Employment and Social Development Canada, and various ministries and others as need be. In an effort to reduce the burden of overlapping inspections, the Ministry has been sharing information on temporary foreign agricultural worker inspections with our federal counterparts in the Temporary Foreign Worker Program and various public health units. We continue to explore ways to improve the information and program delivery, not only with the Ministry of Labour, but also with our partners, trying to ensure that we are coordinating our activities with engaging farm and agricultural stakeholders. So in an effort to provide education, support, and compliance assistance to employers in the ag sector, the Ministry is currently conducting proactive occupational health and safety visits to farms, greenhouses, and other locations where agricultural workers, including delivery persons and cleaners, are working on farming operations. But during this initiative, our Ministry inspectors continue to enforce the Occupational Health and Safety Act and its regulations, including but not limited to the following: the Occupational Health and Safety Act, Farming Operations, Reg 414, Occupational Health and Safety Awareness and Training, Reg 297, as well as emergency orders made under the Emergency Management and Civil Protection Act. All measures taken to prevent the spread of COVID should also be done in compliance with public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. Now, as you'll see throughout this presentation, wherever you see the underline in the blue font, that these are links that are provided through this document, which will be distributed after the presentation. So you'll have access to all of this information. So the focus of the Temporary Foreign Agricultural Workers Initiative Ministry is currently using the existing general duty section 25(2)H of the Occupational Health and Safety Act to require employers to take every precaution reasonable in the circumstance for the protection of a worker from COVID-19 in the workplace. It includes a focus on screening to prevent workers who may have COVID-19 from coming to work, physical distancing, a 2-meter separation between workers, proper on-site hygiene, engineering controls, and other precautions, including the use of personal protective equipment. The Ministry also employs a team of specialists that may accompany an inspector to provide additional expertise. These professionals include engineers, hygienists, doctors, ergonomists, and radiation experts. They may also bring or make referral to the local public health unit as deemed appropriate. So as of June 17th, across the province, the Ministry has received 60 complaints associated with the farming operation and conducted 202 inspections, 123 proactive and 79 reactive. So the 123 proactive is unannounced, typically inspections where we show up at the farm and conduct an inspection. 79 reactive would be as a result of us receiving a complaint of some nature regarding the workplace. So anybody that works there can call in a complaint, as well as anybody else who may believe that there's some unsafe activity at that farm. You don't have to even be a worker. You can call into our call center, and I'll provide that information later on in the presentation. So there have been no work refusals related to COVID-19 in the farming ag sector. Where noncompliance is observed, inspectors can issue orders, and we have issued 63 orders, and 12 of those were related to COVID-19. So overall, just kind of speaking to the theme or the types of orders, the nature of those orders issued, information and instruction being provided to workers, screening, physical distancing without other controls in place, and cleaning and disinfecting of high-touch surfaces and common areas. The Ministry has also received 13 occupational illness reports as required under Section 52(2) of the Act, and I'll go into that a little more later in the presentation. I'll hand this over to Vince from our district office in Windsor. And Vince, I'll flip the slides as you let me know when you want them changed.
Thank you, Ron. Hi, everyone. Thank you for inviting me to participate in this webinar. My name is Vince Latona. I'm the Acting Manager for the Ministry of Labor, Training Skills Development in the Windsor District Office. I've been with the Ministry of Labor for approximately 10 years with previous positions as a construction inspector and more recently, construction program coordinator for the Western region. I do have some extra information that I'll speak to on each slide. Excuse me. When I'm finished, I'll give you the cue, Ron, to advance to the next slide, if that's okay. So you can go ahead and proceed to the next slide. The Windsor District Office boundary includes Essex, Chatham, Kent County, and stretches across Western Ontario to the London borderline, just north of Wallsburg, Dresden, and Dutton counties. In 2020, Ontario anticipated just over 20,000 temporary foreign workers to fill positions in the farming and agricultural sector. Nearly half of these workers came to Windsor, Essex, and Chatham, Kent areas. Over 200 farms applied for the temporary foreign agricultural workers in the Windsor, Essex, and Chatham, Kent areas. The province of Ontario, the Windsor office is uniquely situated in an area where the majority of the province's greenhouses are located, which see a significant number of temporary foreign agricultural workers come to the area each year. Last year, approximately 3,000 temporary foreign agricultural workers were working on greenhouses and farms throughout the Windsor area. Next slide, please. As part of the Ministry of Labor's Temporary Foreign Agricultural Worker Initiative, as of June 17th, 2020, Windsor District Office has completed 60 field visits to over 50 farms. 13 field visits were reactive as a result of formal complaints. Ongoing investigations include 2 of the recent fatalities suspected to be COVID-19 related. The Windsor office maintains weekly contact with Windsor Essex County Public Health Unit to help prioritize proactive visits to farms with suspected outbreaks. We also have a close working relationship with the local consulants in the area. As of June 22nd, which is today's date, we've now performed 71 field visits under this initiative. That includes going out after hours and during weekends. Next slide, please. Based on data collected, an overwhelming majority of farming operations that have experienced outbreaks were using short-term contract workers hired through temporary agencies. In an effort to address some of the unique challenges experienced in Southern Ontario, inspectors in the Windsor District Office have begun conducting visits to short-term employers who provide temporary workers to the farming community. Short-term workers who visit multiple workplaces over the course of time are potential vectors for transmitting the hazard of a virus. Even Ministry of Labour inspectors are also vectors for transmission and must take extra precautions when we visit workplaces. Whether it be a greenhouse, farm, or temporary agency, all of these are employers and have responsibilities under the Occupational Health and Safety Act. When it comes to information, instruction, supervision, and training, all employers have the same responsibilities to take reasonable precautions to protect their workers. Inspectors are asking specific questions regarding working arrangements to ensure adequate safe working procedures and COVID-19 related measures are in place for all workers, including those brought in to assist for short duration work. Isolation procedures, screening measures, and maintaining physical distancing, bunkhouse accommodations, personal protective equipment are some of the topics thoroughly discussed for each visit. I don't want to be too redundant because we're going to share a lot of considerations that we look for throughout this slide. However, in our discussions, we also consider things like transportation of workers, alternating work via shift, the use of barriers, or commonly what's used is plexiglass screens, and even temporary workstations. Inspectors will assess the workplace in person and ask specific questions to ensure adequate precautions are being taken with respect to COVID-19. We'll issue a field visit with all the points discussed and even orders for compliance under the Occupational Health and Safety Act if necessary. That concludes my slides. Thank you for having me. And unfortunately, I'll have to jump off, but I know my counterparts will be happy to answer any questions that you may have. Thank you.
Thank you, Vince. Now we'll go ahead.
Thanks, Ron. Hi, everyone. I'm Denise Madsen. I'm the Ministry of Labour's infection control consultant for the Northern and Western regions. I've been with Ministry of Labour for over 10 years and providing infection control consulting both in the field and in other manners. Next slide, please. So with regard to infection control, you want to protect your best resource, and that's why we look at how to prevent occupational health infections. We know that workers are the most important resource, and we know that a healthy and effective workforce benefits everybody. The main purpose of the Health and Safety Act is to protect worker health and safety, and this includes protection from infectious diseases. So exposure in the workplace, to infections is notice of occupational illness, exposure in the workplace to infectious agents, and an infection that results as a result of that exposure is acquired in the workplace and therefore an occupational illness. We have 4 infection control consultants across the province. Normally we just have 2, but with the onset of COVID-19, we brought in 2 acting consultants to help with the bulk of issues that have come in. The role of the infection control consultants, we provide subject matter expertise and guidance to both internal and external stakeholders with regards to worker safety related to infection prevention and control, and that is for all sectors of Ontario workplaces. And you may, at times, if we come for a field visit, you may have an infection control consultant accompanying an inspector. Next slide, please. So when we talk about infection prevention and control measures, we have to think about where workers may be exposed to infections. Potential exposures can occur from infectious materials, body substances, contaminated surfaces, contaminated equipment, contaminated supplies, and contaminated environment. So those are ways that workers are exposed. So as part of your control measures to have in place, what we look for is that a risk assessment is done by the employer. And this evaluates hazards with relation to infection prevention and control. So it has to be done for all occupations, all roles, and the tasks performed. And it identifies where there may be exposures or spread of infections related to those tasks that are performed and through the risk assessment, and that would be for all workers at the workplace in the organization, and that would be for related to all tasks, and then what infection hazards present themselves. Then the control measures should be put into place, and those risk control measures would follow the hierarchy of control. So with the hierarchy of control, we apply them to any hazard, and for respect to this presentation, it's with COVID-19. And with the hierarchy of control, the school of thought is from the most control to the least control. So the controls in the context of infection prevention and control simply represent breaking the link of infection, how infections are spread. Keep in mind that with infections, we can't always completely control it at the source, but each individual control that we put into place is meant to minimize the risk. And that's what it's all about, is minimizing the risk reduction. With the infection control measures, it's important that organizations apply this to anyone coming in to do business at the workplace or within the workplace on site. That's not just the infection control measures and procedures do not just apply to workers and supervisors and employers. It applies to people coming on site from outside of the workplace as well. So that's an important thing to remember. And then we have to keep in mind on how infections are spread. And with respect to COVID-19, we talk about direct contact. So direct contact is something like a handshake, simple, straightforward, direct contact. Indirect contact is when it's deposited on surfaces or tools or objects. So by indirect contact, you have contact with that has been contaminated by someone with COVID-19, and then having our fingers or hands on it, and then putting our fingers into our eyes, nose, or mouth. So that's how that's transmitted. And then it's also the mode or the method of how it's spread, to be knowledgeable. COVID-19 is contact, droplet, and or airborne spread, or a combination of those. So it's important to know how it's spread, and then how you put those breaking of the chain of infection prevention links into place there. So back to the hierarchy of control, when we're looking at those with respect to engineering controls, that would take into effect things like ventilation changes, if they can be done, or physical barriers, something like plexi barriers, or workstation remodifications or changes to allow for distancing. Many things can be done engineering-wise. Administrative controls and good work practices include policies and procedures that support those engineering controls, things like good hand hygiene practices, simple access to water and soap is effective for COVID-19 or alcohol-based hand sanitizers as well. It's not always business as usual. I mean, there could be portable water put out in fields with soap dispensers. So there are many portable measures and strategies to make sure good hand hygiene is provided. As an example, cleaning and disinfecting, very important. There is a good example of indirect contact. So again, I mentioned tools and equipment. Appropriate disinfecting solutions should be used to make sure that they have the kill factor that's required. High-touch areas should be cleaned more often, and basically within the environment, living areas, bunk areas, eating areas, wherever people have high contact while physically distancing. Guidelines for ill staff, another issue. Do workers know what the symptoms are? Do you know what the symptoms are? Are you aware of who to report them to? Are you aware of if you become ill, what needs to be done? Are you aware of if you do become ill or symptomatic or positive for COVID-19, is there a return to work process to come back to work from the employer? And then our last line of defense is always the PPE, and that could consist of gloves, masks, some form of facial or eye protection, or apparel covering. So PPE is considered the last line of defense, and it can be used singularly or usually in a combination of PPE. And then with regards to education and training, it is important that everybody gets some kind of information on safe practices for the control of infections. Again, they have to be relevant to their work and relevant to their task. There has to be awareness of the hazards associated with infections in the workplace. And this is for anybody that may be subject to biological agents or infectious disease transmission as a result of being at the workplace. With education, it's important that it is basic fundamentals that workers should understand based on the infectious disease hazards that may present at the workplace, and particularly to know how it's spread, either by contact, droplet, airborne, or the means by how the virus can move around, and understand the protective mechanisms that are in place or could be put in place to protect your own health and safety. And then evaluation is really important in workplaces to look at what's being done, if it's being effective, and if it's not effective, look at other things to do, other improvements to make, put those into place. So reevaluating on a constant measure is very important. So if things aren't necessarily working and you're still having outbreaks, it should be reevaluated to, okay, what else can we do to prevent the spread of infections? And that's it. I will stay on for questions. Ron, you're next.
Thank you. All right, so I'm going to go on. Next part of the presentation has to do with the internal responsibility system. So this basically, you know, this is how your health and safety system works at the local farm agricultural setting. So the Occupational Health and Safety Act makes it clear that employers have the greatest responsibilities with respect to health and safety in the workplace. However, all parties have a responsibility for promoting health and safety in the workplace and to help the workplace be in compliance with the Occupational Health and Safety Act. The respective roles and responsibilities for all workplace parties are detailed in the Occupational Health and Safety Act, and which is the basis for the internal responsibility system. So as you can see by the chart on the left, you know, it isn't just the employer's duty, it isn't just the supervisor's duty, it isn't just the worker's responsibility. Everyone has a part to play in the internal responsibility. So everyone has a role. So So workers who see a health and safety problem in the workplace have a duty to report the situation to the employer or a supervisor. Employers and supervisors are required to address the issue and ensure that workers on a farming operation are aware of any hazards. So employers have obligations on the Occupational Health and Safety Act and its regulations to protect workers from hazards in the workplace, including infectious diseases. So some of the key employer duties are to take every reasonable precaution in the circumstance for the protection of a worker, to provide, maintain, and ensure proper use of equipment, materials, and protective devices, ensuring required measures and procedures are carried out, provide information, instruction, and supervision to workers, and to acquaint workers and supervisors with workplace hazards. So the ministry's guide is for employers, whether you're currently operating or planning for your workers to return to work. The guide will help you develop a plan to work safely. It will help prepare you to put controls into place to make the workplace safer for everyone. So the safety plan template can be accessed using the link in this presentation, again, which will be shared with you at the end of the presentation. As quickly as possible upon arrival, workers should be instructed on the farm safety plan in a language they understand, for example, some form of orientation training. And you can check the resources to prevent COVID-19 in the workplace for sector-specific information, examples of controls that apply to your workplace specifically. There's a ton of information available through the link. What to do if someone tests positive? So under the Occupational Health and Safety Act, subsection 52.2, if an employer is advised that a worker has an occupational illness due to an exposure at the workplace, or that a claim has been filed with a Workplace Safety Insurance Board, the employer is required to notify the ministry in writing within 4 days. So as a worker, it's very important that you let your employer know if you have signs or symptoms, or if you've tested positive, or that you have filed a claim for occupational illness with Workplace Safety Insurance Board. And if you have any questions or would like to report an occupational illness, you can call our Occupational Health and Safety Contact Center at 1-877-202-0008. We also have an email address location that employers can use for reporting occupational illness. So there's some required information in the occupational illness notice. So generally the written notice should include the name, address, and type of business of the employer, a description of the occupational illness and what may have caused it, the period when the worker was affected, the name and address of the worker affected, name and address of the physician or other medical practitioner, if any, who was or is attending to the person for the illness, and the steps taken to prevent further illness. So failure to comply with the Occupational Health and Safety Act and its regulations can carry penalties for noncompliance. So in the event that compliance with the Occupational Health and Safety Act or an MLL inspector has not been met, the MLL can charge and prosecute a corporation or an individual. So if an individual is found guilty of an offense, it could be liable for a fine of up to $100,000 or up to 12 months imprisonment, or both. And the corporation, so basically the employer, if found guilty of an offense, is liable to a fine of up to a maximum of $1.5 million. And any inspector's decision can be appealed to the Ontario Labour Relations Board. So whenever we do a field visit, we leave a field visit report, and on the bottom of each page of that report is information on the Ontario Labour Relations Board, and an appeal can be filed within 30 days, and the appeal could be, you thought an order should be written and it wasn't, or maybe an order was written and you don't think it should have been written. So things of that nature are typically the topic of appeals. So of course, there are worker rights on the Occupational Health and Safety Act, including the right to know about hazards to which you may be exposed. Employers are legally required to provide information, instruction, and supervision to all workers and supervisors about known health and safety hazards in the workplace. They also have the right to refuse unsafe work. Employers are not allowed to fire, discipline, or penalize a worker for following workplace health and safety laws or refusing unsafe work. You also have the right to participate in identifying and resolving health and safety concerns, including issues related to COVID-19. For example, through membership on a joint health and safety committee or health and safety representatives. And along with rights comes responsibilities. So workers should follow the safe work procedures and the requirements of the employer's health and safety policy. Workers should be aware of and follow public health directives and guidance issued by Ontario's Chief Medical Officer of Health and the Ministry of Health. Again, a link provided there to visit that site regularly, checking for updates as they come about. There is regular updates. And if a worker becomes ill due to COVID-19 or experiences any symptoms, the worker should report it to a supervisor immediately so that others can be tested and further controls can be put in place to prevent spread. If a worker sees anything that looks unsafe, not only COVID-19, but anything that looks unsafe in the workplace, they should tell the supervisor or employer right away, and the worker may also speak to a member of the Joint Health and Safety Committee or a health and safety representative. So it's always much easier to spot something, report it, have it addressed before someone gets injured or ill. So some of the differences between Joint Health and Safety Committees and health and safety representatives. So Joint Health and Safety Committee is required when there are at least 20 regularly employed workers on farming operations such as mushroom, greenhouse, dairy, hog, cattle, and poultry. And farming operations that regularly employ more than 5 workers but are not one of the 6 specified commodity groups are required to have a health and safety representative. So the following chart just goes through some of the differences between Joint Health and Safety Committee and health and safety responsibilities. So inspecting the workplace at least once per month, it's the same for both. Identify workplace hazards and make recommendations to the employer, same for both. Obtain information from the employer regarding identification of hazards, same for both. Inspect workplace and investigate following critical injuries, fatalities, or work refusals, same for both. Opportunity to accompany the Ministry of Labor inspector during inspections of the workplace, same for both. And committee meets at least once every 3 months and keeps minutes. That's only for the Joint Health and Safety Committee. And certified Joint Health and Safety Committee member may initiate bilateral or unilateral work stoppage if they believe that dangerous circumstances exist. Again, for the Joint Health and Safety Committee only. So as far as determining what regularly employed is, we typically consider a 3-month average. So if you have fluctuating workforce levels, look at the average over 3 months and determining whether or not the Joint Health and Safety Committee or Health and Safety Rep is required, as well as taking into consideration the specified commodity groups. So employers are not allowed to reprise against or punish a worker for obeying the law or exercising their rights. So your employer cannot dismiss or threaten to dismiss you for reporting unsafe conditions or for working as per the Act and its regulation, working in compliance with the Act and its regulations. They cannot discipline or suspend a worker or threaten to do so, and they cannot impose or threaten to impose any penalty upon a worker or intimidate or coerce a worker. And if you feel that you may have been reprised against, you can call our contact center at 1-877-202-0008 or email using the email address provided on this slide. The Ministry of Labor Training and Skills Development is here to help. We have our Occupational Health and Safety Contact Center, which you can call anytime to report critical injuries, fatalities, or work refusals. General inquiries can be received between 8:30 and 5 p.m. Monday to Friday. We also have a toll-free number. When you dial that number, if you press 1 to report an accident or work refusal, press 2 to report a complaint, including COVID-19 concerns, and press 3 if you have any questions. And once you actually get to a telephone agent, so an actual person on the phone, you can ask for service in any other particular language. Just let them know and they will make the arrangements so you can communicate in the language of your choice. You can also email questions to the email address provided, and you will get a response within 5 business days. And of course, in an emergency situation, always call 911. We have a number of resources available in the ministry. Employers and workers can refer to the ministry's Guide to the Occupational Health and Safety Act for farming operations to help understand their health and safety rights and responsibilities. For COVID-19 specific agricultural resources, please visit the ministry's Agriculture Sector Guidance Notes and Workplace Safety and Prevention Services Guidance for agricultural workers and agricultural supervisors. In addition, training workbooks and accompanying guides are available for download, including Worker Health and Safety Awareness in 4 Steps, Worker Awareness Workbook, Employer Guide to Worker Health and Safety Awareness in 4 Steps, and Supervisor Health and Safety Awareness in 5 Steps. We also have a number of online resources. Employers and workers can refer to the Ministry's Guide to the Occupational Health and Safety Act for farming operations to help understand their rights and duties under the Health and Safety Act and its regulations. Ministry of Health also produced the following guidance documents: guidance for temporary foreign workers and guidance for group homes and co-living settings. Please check with the Ministry of Health COVID-19 website regularly for updates, frequently asked questions, and other information related to COVID-19. And that's the end of my part of the presentation.
The worker lens, but in the meantime, there have been a few questions in the chat box, and then we will I think these 3 questions we can maybe ask, and then we'll have time later at the end. So there's a question from Tanya about, are workers aware that they can apply for WSIB if they test positive? I know that that's a WSIB question to some extent, but does the Ministry of Labor discuss WSIB with workers and employers at all, I guess would be the question for you. And then the question about how many have applied. Tanya, I just looked it up on their website. It looks like about 353 right now, which changed from last week's. But Ron, do you have any comment from the Ministry of Labor perspective on just informing workers and workplaces about the coverage for WSIB?
Yeah, so it's obviously beyond their mandate as far as responding to the numbers being reported. I understand you've pulled some information, but yeah, I'm not. I really can't comment on what outreach WSIB has done as far as providing information to workers in farming and agriculture. I do know that we have provided a suite of information to our inspectors, going out and delivering that information to workplace parties. So we have the field visit report, which contains kind of a summary of what the visit was. It'll have orders and timelines for completion or compliance for those orders. But there's also a section of the field visit that is the detailed narrative portion. So in that portion of the field visit, the inspector can provide links and other resources that the workplace parties can use to further advance their internal responsibility system, which can also include, links to WSIB as an example.
Okay, thanks. And the next question is related to, I guess, classification of COVID-19 as an occupational illness. Has it in fact been named as such by the ministry? And if not, what are the plans, or does it become one by default as soon as someone gets sick at work?
So it's not like there's a list per se in the legislation as to what it is an occupational illness. COVID-19 is considered an occupational illness if it was acquired as a result of workplace exposure, or the employer is aware that the worker has submitted a claim. So we're speaking specifically to COVID-19 because that's the nature of this whole presentation. But the 52.2 requirement is for any occupational illness, not just COVID-19. So there's no updated list. It's whether or not it's an occupational illness to begin with.
Okay, great. And the last question we'll take right now, I think, is what kinds of orders have been issued around COVID-19 infection control in agricultural operations, if any?
Well, as I said earlier in the presentation, a lot of the orders that have been issued have to deal with, what are the screening techniques, cleaning precautions, education of workers. So they typically fall under one of the clauses, one of the general duty clauses in general. But we looked at overall information instruction provided to workers, the involvement of the Joint Health and Safety Committee or safety rep, social distancing, screening methods, hygiene, and personal protective equipment. Sort of a, that's sort of the checklist almost of things that we look at, and that may result in orders.
Okay, thank you. We will get Eduardo to load his presentation, but I see there's one more, I guess, so maybe you can answer. Just, is there a plan for the ministry to implement new guidelines potentially in light of the emergent safety agreement between Canada and Mexico? And how might this agreement be reflected in oversight or inspections?
Yeah, so obviously I've heard about the agreement. It's gotten a lot of play in the media. Whether or not it has any impact on the day-to-day operations of our ministry, that has yet to be determined. There's been no communication in that regard. So it's a wait and see.
Okay,